My name is Dee Dee Cotton.
My name is Elizabeth Wickham.
We are second-year DPT students at Campbell University. Today, we are demonstrating PNF for lower extremity strengthening. Proprioceptive neuromuscular facilitation techniques, also known as PNF, provide the clinician with effective means for examining and treating structural and neuromuscular dysfunctions. PNF can be used to improve strength, range of motion, or motor control for upper and lower extremities. Today, we will focus on PNF patterns for strengthening the lower extremities. The concept behind PNF is that the proper sequence of a contraction determines its effectiveness. The facilitation of movement patterns promotes motor learning and synergistic muscle patterns. 80% of muscle strengthening starts with motor control and neuromuscular education, which is an underlying benefit of PNF. These patterns of movement and posture are important for facilitating functional skills such as putting on pants, getting into the car, or stepping into the bathtub, but can also be applied for higher level activities. The PNF techniques increase in difficulty, starting with rhythmic initiation and ending with rhythmic stabilization, and should be applied to functional movements such as walking. PNF can be performed in sideline, supine, quadruped, sitting, and standing positions based on the needs and the progress of the patient. Functional gains through PNF can be assessed by having the patient perform functional movements. Mayo muscle testing can also be used to evaluate strength gains in targeted muscle groups.
D1 and D2 patterns for the lower extremity can be performed unilaterally, bilaterally, whole limb, or segmentally. For PNF, the clinician should be aligned in the plane of movement pattern being performed, and her hands should facilitate the direction of the limb that it needs to move in. For today's video, we are not doing that. PNF strengthening is not just for muscle hypertrophy, but translates to overall functional movement. Distal movements should occur before proximal and should be completed no later than halfway through the pattern. Once the end of the desired range is reached, the preparatory command is given to reverse the direction, and the clinician's hands are switched to then resist the opposite pattern. If you were going to explain it to a patient, this is what you would say. Today we're going to work on strengthening the lower extremities by moving your legs through specific patterns. Today I'm going to introduce the pattern, and then I will have you push into my hands to build strength. For D1 flexion, position the hip in extension, abduction, and internal rotation. The knee is positioned in extension with the foot in plantar flexion and eversion and the toe flexed. The therapist provides resistance on the dorsal medial surface of the foot and on the anterior medial aspect of the thigh. The therapist tells the patient, pull your foot and toes up and in, bend your knee, and pull your leg over and across. Up and in, over and across. For extension, the resistance is provided on the plantar and lateral surface of the foot and posterior aspect of the knee. Tell the patient, curl your toes, push down and out, down and out. Up and in, pull across, down and out, down and out, down and out. Up and in, pull across, down and out, push, 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 push. For D2 flexion, the position of the hip is in extension, adduction, and external rotation. The knee is positioned in extension with the foot in plantar flexion and inversion and the toe flexed. The therapist provides resistance on the dorsal lateral surface of the foot and anterior lateral aspect of the thigh. The therapist tells the patient, bring your foot and toes up and out. Lift your leg up and out, up and out, up and out. Okay. For the extension pattern, resistance is provided on the plantar and medial aspect of the foot and posterior medial aspect of the knee. Tell the patient, curl your toes down and in. Push your leg down and in, down and in. Lift your leg up and out. Down and in. Up and out.
Evidence shows PNF has the same strength gains for low-level patients as isokinetic training, but PNF utilizes more functional movement patterns for rehab purposes. In another study, PNF demonstrated immediate and cumulative strength gains in subjects with hemiplegia using rhythmic initiation and slow reversal techniques. Gait speed and cadence improved within the first session and continue to improve within the 4-week trial. Results from a third study demonstrated resisted PNF improves balance, symmetrical weight acceptance, and gait in transfemoral amputees. These are just some of the benefits and applications that PNF can be used for.